Hi everyone and welcome to our channel. Today we're going to discuss the importance of discussing teenage pregnancy and creating awareness on how to prevent it. To start, according to Larson 2007, did you know that nearly 100,000 children in Canada are born into poverty each year? Pregnant women face a variety of challenges, such as being a teenage under single mother, unemployment, and cramped living conditions. As a result of this, children might develop health concerns, including elevated risks for preterm delivery, intrauterine growth restriction, and newborn or infant mortality. In addition to this, it has been proven that poverty is also a factor in poor academic achievement and delayed cognitive development. There is also a considerable correlation between behavioral issues in early childhood and adolescence and maternal poverty. And though this is a concerning situation, there is limited evidence in favor of policies and initiatives aimed at reducing this issue because of insufficient assessment and critical appraisal. An easy way to prevent unwanted pregnancies is to increase awareness of the effects they have on the child and mother.
Important factors associated with medical outcomes. When the socioeconomic status is low, medical care is inadequate, and this has been attributed to diverse outcomes. With pregnancies, these risk factors, due to restricted access to healthcare, are still present and can result in cases of abortion, preterm delivery, preeclampsia, eclampsia, and gestational diabetes. All around the globe, different countries have adopted methods to help prevent and deal with conditions to these pregnant women that live in low-income communities. However, positive outcomes haven't been evident. Internationally speaking, there are two key countries that have addressed this problem. On one hand, Korea comes with a specific healthcare system for low-income communities. The medical aid, also known as the MA, has a coverage of approximately 2.9% of the population, granting low-income individuals access to healthcare at a low expense. Besides this MA, Korea also has the NHI, the National Health Insurance. This is for middle and high-income individuals. The Korean government implemented supplementary financial aid for prenatal care for expectant mothers. This program has been going on since 2008. However, it still remains unclear whether the adverse pregnancy outcomes observed in low-income women are caused by low socioeconomic status or by economic barriers specific to accessing medical services. On the other hand, the United States presents more problems with low-income women when it comes to childhood and raising the child. Low-income women who often lack flexibility in their schedules and don't receive paid sick or maternity leaves find it hard to access healthcare, leading to families not being able to spend enough time with their newborns, and these families are also forced to look for expensive childcare, which can cost over $20,000 a year per child, depending, of course, of their location and how long they need the care. So this means that in the United States, the good healthcare for these children and prenatal care is really hard to access. These other countries with this problematic is really notable. However, there are other countries all around the globe this problematic is really evident and it needs to be addressed ASAP.
Good morning, everyone. We are here with the specialist gynecologist from the Harvard Institute who is going to answer us some important questions about contraceptive methods. Good morning, Lucia. How are you?
Good morning, fine, and you?
Very nice, thank you.
I'm so glad to be here.
That's awesome. So, could you tell us a bit more about what are contraceptive methods and why they're important?
Of course, these methods are a device or medication that aims to prevent pregnancies or unintended pregnancies. It enables women to control their fertility and plan when or if they want to have children. Also, it promotes reproductive autonomy and reduces rates of unintended pregnancy and the need for unsafe abortions.
Thank you, that was so interesting. And can you tell us a little more about the benefits and consequences of the pill?
Yeah, sure. So the benefits include that the pill is accessible, also helps to treat agony and irregular periods, and it has a high effectiveness. However, it has some consequences that includes it requires daily adherence, so you need to be like very obedient. It could have some side effects, and it has no protection against sexually transmitted infections.
And what are the most common and affordable contraceptive methods?
Okay, firstly, it is important to know that no method of contraception is 100% effective against pregnancy. However, to answer your question, for example, condoms, birth control pills, implants like for example arm implant, intrauterine devices, and injections. And the best ones include intrauterine devices and arm implants.
Thank you. And is it possible to have access to one of these contraceptives even without a healthcare professional?
Yeah, of course. Depending on the regulations and availability on your country, the contraceptives do not require a prescription or consultation with a healthcare professional and can be purchased at any pharmacy, family planning clinics, or reproductive health centers. For example, the condoms are emergency contraceptions, for example, the morning after pill, and contraceptive patches. However, while some contraceptives can be obtained without a healthcare professional, it is still advisable to consult a specialized doctor for advice.
Thank you so much. So now that we have this very valuable knowledge about contraceptives, it is important for you to spread this awareness about contraceptives and information to local communities that do not have access to this type of education. See you next time.
Is unneeded pregnancy rates and access to different factors. So first, we will start with greater risk of unplanned pregnancy. So here is limited access to healthcare. People with low income often lack health insurance or face financial barriers to regular checkups and preventing measures like contraceptive. Lower awareness. Educational limitations and restricted access to resources can lead to a lack of knowledge about family planning, options, and safe sex practice. Secondly, we have consequence of unwanted birth. So, financial strain. Raising a child comes with an immense financial burden. Poor families already struggling to meet basic needs face amplified hardships. Reduced social mobility. The mother's ability to pursue education or better employment opportunity gets hampered, hindering the family's changes to break a poverty cycle. Also, the unplanned additions can lead to stress on the relationship within the family. In third one, we have limited options. This one is the most important one. Restricted access to abortion. Financial constraints and geographical limitations can make it difficult for low-income women to access to safe abortion service, especially in regions with restricted abortion law. So finally, we have healthier families in contrast. Have a better access to healthcare. Regular checkups, comprehensive sex education, and affordable contraceptives can significantly reduce the risk of reunited pregnancies. Can afford quality pregnancy care. This ensures a healthier pregnancy and better birth outcomes for both mother and child.
It is evident that this is a growing issue and must be taken into consideration worldwide. Misinformation is one of the main factors that has contributed mainly to this growing issue, and it is very important that this is covered right this instant. Women must have access to sexual education and information about pregnancies, not just for their own health, but also for the ones that surround them, and even for future lives. Please don't ignore this video. Stop the suffering for many women and contribute to the cause. Spread awareness of this growing problem for the world to make this world a better place.